The World Bank has approved its first set of emergency fund allocations and support operations for developing countries facing the pandemic, and India will be receiving $1 billion, the highest amount of these funds allocated by the World Bank. These funds will be dispersed in a fast-track mode, single-window facility to carry out the process dedicated only for COVID-19 response. The first set of fund allocation will amount to $1.9 billion and will aid 25 countries. The World Bank wants to extend its COVID-19 support operations to more than 40 countries in the coming days. The organization is also mulling on redeploying resources worth $1.7 billion and is ready to release close to $160 billion in the next 15 months to fight the impact of the pandemic and fix the global economy that is being crippled by it. In India, the novel coronavirus has infected more than 2,500 people and has killed over 70. The country is in its 11th day of lockdown and it still continues to be under a massive threat. Having been allocated the highest emergency fund from the World Bank, India will also use these resources for laboratory diagnostics and procurement of medical and protective gear to end the crisis. The World Bank is also funding Afghanistan with $100 million to slow the spread of the virus, and in Pakistan, where the pandemic has resulted in the death of 34 people, aid worth $200 million will be used in preparedness and emergency response. Yemen in the Middle East will receive aid worth $26.9 million, and Africa's Ethiopia, Congo and Djibouti will receive a total funding of $134 million. But the lethal coronavirus has already made an entry in the war-ridden Middle East region, worsening economic situation in the region, displacing refugee populations, and the failed states of Libya, Yemen and Syria have very limited resources and medical facilities are now facing a higher threat. In countries like Mongolia and Cambodia, where the World Bank has allocated $26.9 million and $20 million respectively, COVID-19 is yet to take the lives of its victims. But the virus continues to be a huge threat due to poor medical infrastructure. The only positive factor working for these countries is that the small population is limiting the spread of the virus. Prognosis for COVID-19 in Central Asia is grim. Poor healthcare facilities, crumbling infrastructure and low ranking in several global indices has put these countries in a grave situation. In Kyrgyzstan and Tajikistan, nurses are wearing raincoats to protect themselves from the infection. The World Bank has allocated $12.15 million to Kyrgyzstan, where 435 cases have been reported, and $11.3 million to Tajikistan, which is yet to report a single case of COVID-19. The World Bank's first set of operations for COVID-19 crisis is set to ensure the broadening of economic programs and recover from the crisis as quickly as possible. It also aims to create an atmosphere of growth and development for small and medium businesses and the poor, who are the most vulnerable during this crisis.